This is a video about constraint-induced movement therapy, and it has been made for parents of children with hemiplegic cerebral palsy. Firstly, what is it? Well, it's a type of therapy that has been specifically designed for people with hemiplegia, i.e. one side of their body affected, and it's particularly for the upper limb. It consists of two parts: restraint of the unaffected upper limb and intensive practice of the affected upper limb. Constraint-induced movement therapy can be implemented in a number of different ways, depending on the type of restraint that's used, the type of practice, how much is done and how often, and who actually carries it out. Constraint-induced movement therapy can be useful for children with hemiplegic cerebral palsy, but not all. So it's important that there's an initial assessment of the child's suitability and parents understand what is required for implementation. I have developed a type of constraint-induced movement therapy which is carer-directed and prolonged. Carer-directed because I ask families to carry out the intensive practice with the affected upper limb at home, and prolonged because the short arm device that I use to limit the use of the unaffected upper limb is left in situ. This can be for days or it can be for hours, depending on what the family think the child will tolerate and is acceptable. I would like to show you a video of this in practice. The young lady in question, we're encouraging her to use her right hand. She has a left short arm device in place. This is left on for a couple of hours every time Mom applies it. She's practicing quite precise grasp release with that hand. This practice allows a possibility of learning motor skills with that right hand. Also, the activity of the right hand will help to strengthen it and keep it relaxed. Mom has done brilliantly. She's found a toy that this young lady can use successfully, so she's not going to get too frustrated and she's prepared to repeat. Repetition is really important in motor learning. Constraint-induced movement therapy is working well here because if she didn't have the short arm device in place, she would probably be using her left hand rather than practicing with her right hand. Thank you for listening, and if you have any questions, please do not hesitate to contact me.